Well, hello, friends. It's another time that we have opportunity to have kidney talks. I am your host with Reverend Dr. Kendrick Curry of the Pennsylvania Avenue Baptist Church in Washington, D.C. And I am so excited, as always, to have these kidney talks in conjunction and coordination with the Ron and Joy Paul Kidney Center at the George Washington University, and certainly at MOTEP, which is the Minority Organ Tissue Transplant Education Program. And I have some wonderful, wonderful co-hosts with me. I have Dr. Clive Callender, and who is a professor of surgery at Howard. And I also have Dr. Joseph Keith Melanson, who is the chief transplant surgeon at the Ron and Joy Paul Kidney Center, as well as professor of surgery at the George Washington University Hospital. And today we have an outstanding conversation that's going to come up around organ donation, which is Washington Regional Transplant Community. And we're going to have Jacoliah Daniels, who is Director of Community Affairs, and certainly Kenny Boyd, who is also part of that wonderful community. So let's welcome everyone on screen, and let's get ready for a wonderful conversation around organ transplantation. And I'm not sure who wants to go first, but before we begin, certainly let's have Dr. Callender and Dr. Melanson. Any opening comments or thoughts?
Yeah, I'm thrilled because it's uh, National Minority Donor Awareness Month, and so this is a special occasion in which we are highlighting the need to get minorities to participate in transplantation of organs and tissues. And so I'm excited to be part of this program with such great guests.
Uh, and Dr. Curry, it's an honor to be here discussing organ transplantation, particularly during this month. And it always brings to mind a paper that I had the pleasure of writing with the great Dr. Callender, where we showed, and primarily as a result of the work of MOTEP in inspiring donor organizations like WRTC, where we showed that African Americans, who used to be the lowest of all ethnic groups in donation after death, are now number one by percentage in the country. So we are so proud of the fact that you get out there, you educate people, and they will effectuate a change in their community. So I'm proud to be here. And like I said, Dr. Callender has inspired all of us.
All right. Well, I would love to hear from Ms. Daniels and Mr. Boyd regarding just this organ transplantation and what WRTC really does and how we can really be better participants in terms of organ donation. So, um, where shall we start? Jacoliah, I would love to hear your perspective as well as yours, Mr. Boyd.
Oh, good afternoon.
Good afternoon.
Normally ladies first, but I'll start if you don't mind, Jacolia. All right. I work for the Washington Regional Transplant Community. We are a federally designated organ procurement organization. Organ procurement organizations are in place to ensure that the equitable distribution of organs occur. It's illegal to buy, sell, barter, or trade organs in the United States of America. And so our ability to bring trust to that system of allocation of organs is very important. WRTC is one of 57 organ procurement organizations. We're responsible for the DC metropolitan area. We work with our donor hospitals and our transplant centers. And essentially, the OPO is the bridge between families who have experienced a loss and made a decision very heroic decision to donate, and recipients who are waiting for a second chance. And there's more than 100,000 people across our country who are waiting for a second chance. That chance is facilitated because of that partnership that the organ procurement organization has with their donor hospitals and our transplant centers. That's a kind of quick
Wow.
summary.
All right. Jacolia, how about you?
Well, I mean, there's a critical need for organ donors even today, with as far as this has come as an acceptable therapy for people in end-stage renal failure. There is a critical need for organ donors. We know that every single day, 17 people will die because the organ that they need is not donated in time. And our work will continue until everyone who is on that national transplant waiting list receives the organ that they need. How are the ways that we increase the number of registered organ and tissue donors? We do that in a variety of ways, especially grassroots initiatives, but we're really trying to reach marginalized communities and educating them. There's a lot of myths and misconceptions that exist in those communities, especially about organ donation, and we want to encourage people to get the facts. Um, and another part of that is just, meeting people where they're at. There's a lot of medical mistrust that exists as well. And these are valid fears that people have. And so a good day for us on the job is when we can have meaningful conversations that might open up people's minds to organ donations and maybe change their perception. And when they go home that evening and they're seeing their loved ones, maybe they'll, talk about donation, and it'll start a conversation in their family. And that conversation will hopefully ignite something really beautiful. So that's what we're all about.
Well, I like to jump into some questions from our esteemed co-panelists and sponsors, Dr. Melanson, Dr. Calendar. I know transplantation is something that's big on your minds and hearts, and I know what you've done with the Kidney Center and your leading work, Dr. Melanson and Dr. Calendar. So, would you share with us a little bit about the Roy and Joy Paul Kidney Center, and let's talk about transplantation?
Yeah, thanks, Reverend Curry. Well, I already talked about my ongoing relationship with Dr. Calendar and the work that MOTEP has done in the community. But I can tell you, I've been in the Washington, D.C. area for a long time. And one of the keys of dealing with what people have to deal with when they get to end organ damage, which is making sure we have enough donors, it all starts with education. And, again, Dr. Calendar showed us the way in the sense that the way MOTEP is organized, it's a grassroots organization. You go out and you meet people where they are. It's not okay to just have, like didactic sort of sessions only when, life and death situations come about. What you have to do is you have to go out into the community and you have to educate people. WRTC has a long history of doing this. Kenny Boyd and his team have done an outstanding job in going into the community and meeting the people where they are. I don't care if it's festivals, if it's speaking to people in their own language, like the Hispanic community in the Washington, D.C. area, which is expanding and now makes up a good percentage of patients we transplant here at George Washington. But the point is, it's a daily sort of process. You can't wait until people are dealing with life and death situations in the hospital to have that first interchange between the organ procurement agency, like like Kenny Boyd said. They're all over the country, but every community is unique, and you have to engage your community on an ongoing basis in order for them to understand that organ donation saves lives throughout the country, but particularly it saves the lives of people in your own community. We have 250 transplant programs across the country, 57 OPOs, and these organizations are integral to providing organs for the patients that need them. There are over 100,000 people that need organ transplants in this country. And it's imperative that we as a community understand that you can't save those lives without donation. Donation can be after death. Donation can be during your lifetime. Live donation is important as well. But what we have to understand is how often people in our sphere of influence will need an organ transplant. Many people may not even understand that people in their community, their churches, their fraternal and sorority organizations, their families, you have no idea how likely one of those people that you know will need an organ transplant. So, in the DMV, when you go to renew your license, I just did it a few months ago. You go in and you check off, I'm willing to be an organ donor. That's great. But in addition to that, it's imperative that you let your family know that you want to be an organ donor, because for the organizations like what Mr. Boyd and Ms. Daniels works for, when they approach the family in a life or death situation to discuss this, it's imperative that that family has already heard from the family member that may be going over to the next life that they want it to be an organ donor. So I totally buy into this concept of going out into the community throughout the year, throughout the seasons, to discuss this and educate people, because that's the way you change minds about organ donation.
Yeah, I think that's tremendous. A great statement you made. Not only establishing the need, but also establishing something that Ms. Daniel said earlier, overcoming or Mr. Board, overcoming misinformation. There's a lot of misinformation that floats around the community, a lot of conspiracy theory and all of that. And the need for WRTC and others to go out and host and hold forums where people can ask questions and get good information, credible information, is very much needed. And I would encourage, I'm open to make sure we have that happen in our faith community. But I'm wondering, how often does WRTC go out and share various things? I think I have some idea, but I'd like for you to tell our wonderful audience. And oh, by the way, audience, feel free to drop your questions in the comment section in the chat. We love to have our expert panelists address them.
I
So,
think Jacolia is best positioned to
Napoleon?
answer this question, but I'm going to say this. Even if we were able to go out 3 times a day, every day, it wouldn't be enough. As long
Right.
as people are dying on the wait list, and as long as our minority community is waiting disproportionately longer than anyone else, we still have more work to do.
A lot of work.
So, to answer your question, we are always looking for opportunities to engage with the community. I know my staff is going to be out, staff and volunteers of ours are going to be out at lots of events this weekend, actually. We know that it's summertime, it's beautiful outside, the forecast looks great here in the Metro DC area, and we're going to be out there educating about organ donation. So, we do this in a variety of ways. We have literature that we can share with people. So, maybe if they're not comfortable having that in person conversation in real time, they can take the information with them, and give resources, online resources, where they can go to learn more about organ donation. And we have these materials in different languages for all people. So we are out there, and another thing we're doing is just finding opportunities to connect and partner with the community so that they know about our mission and they know about our life-saving cause. And so some initiatives we've done recently is we were in Southeast DC a couple weekends ago, giving backpacks and school supplies to students in DC. We'll be doing that again this month in celebration of National Minority Donor Awareness Month in Prince George's County in Maryland. And so we really want the community to know who we are and build that goodwill. So again, when they're hearing things about donation, maybe they're hearing a myth, they'll remember that interaction and that conversation and be able to, have that resource where they can go to get the information that they need to make them feel comfortable about donation. Because it is a complex, organ donation and transplantation is a complex concept. It's a complex industry, but it's important that we're reaching all communities. We know, again, we said at the top of this broadcast that more than 100,000 people are waiting for that call, are in dire need of a life-saving organ transplant. And we know that nearly 60% of those are people who are from multicultural communities. So it's important that we have donors that represent our, diversity. And that's what we're really all about, is getting the word out.
And Reverend Kirk, if I could just amplify
Please.
that in one other area, I think community outreach is really important, but WRTC and the donation community as a whole has also recognized the importance of engaging and educating our medical professionals. I think that we have recognized a blind spot and thinking that all of our healthcare professionals, our physicians and nurses, are well versed in education, and we've addressed whatever cultural misconceptions or concerns they might have about donation. And we're recognizing that that's not true. So Dr. Callender and Dr. Melanson serve as excellent spokespeople and validation to the medical community, but OPOs also serve in that role by providing education to their hospitals, to their nurses and professions, so that we can address it there. Oftentimes in critical situations, families turn to their providers to validate decisions that they're making in these important end of life scenarios. And so for us to have had engaged and built trust with those healthcare providers are also another way that we assist in supporting donation and hopefully in the end servicing those patients on the wait list.
Well, thank you so much for that. I want to follow up with something you said a little bit earlier as we go back. You prefaced the statement before Ms. Daniels came on, saying that even if we did have adequate community outreach, we would still not have enough. And then the figure of 100,000 folk plus coming on the wait list. If we won't have enough outreach, and that's insufficient, what else can we do in order to have the right number of those folk come off of the donor list? What other means can we think about?
Well, and I have the good fortune of growing up in this industry and witnessing the efforts of Dr. Callender and MOTEP, and a lot of his work has been to normalize donation, right? And for that to be as common as getting your driver's license or any other activity, and so we address this issue when donation is normalized. It's the next logical thing. Someone
Right.
passes on, and donation is the next logical. It's without thought because it's the right thing to do. That's where we need to get as an industry. That's our objective, but as a community, that's our goal. That's where that should be our North Star.
Okay. And I was definitely thinking about that and wanted you to say that for our audience, because I know that there are also discussions around other sorts of ways of thinking about making organs available, and that creates some bioethical issues. But I will come back to that. But I do want to make sure that we have an understanding from our audience, and they've raised a couple of questions. One is from Ryan Leonard that says, "Do we have control over who gets what organs, or are we ignoring preferential treatment for the wealthy? Also, remember when white police officers only shot black drivers, they after they noticed that they were organ donors, something along that
Right.
line. But the main question was, do we have control over who gets what organs, or are we ignoring preferential treatment for the wealthy?"
All right. So earlier on, when I came on, I said the important role of the organization, organ procurement organizations, is to ensure that there is a safe and equitable system in how we allocate organs. And Dr. Melanson and Dr. Callender can both amplify this afterwards. But anytime someone chooses to be a donor, the organ procurement organization will input into a computer the height, the weight, the blood type, and some genetic information about our donor. And then we're going to identify recipients based on that information only. So it's race, gender, and social economically blind. Once you make it on the list, you have an equal opportunity for a transplant. And so I want people to understand that when you're in a hospital, they don't know your donor status, and they're more focused on saving your life. And organ procurement organizations become involved after the healthcare providers have exhausted every opportunity to save your life. Donation is an after death decision and an after death process.
You know,
Dr.
if I could
Callender,
just,
Dr. Melanson?
yeah, I just wanted to say, to amplify what Kenny just said, you know, to get at the question a little bit of the what is it being implied, which is, do wealthy people get an advantage in the system? And the answer, Kenny is really talking about deceased donation. In deceased donation, it is possible for a family of the decedent, so the person that's dying, their family can try to direct the organs to someone they may know. So let's
Oh,
say
really?
your
Hmm.
grandmother is has kidney disease and is on dialysis, and someone in that family or a friend of that family is dies, they can say, well, we want you to try to transplant my grandmother. And that is perfectly fine and legal, and we do that in organ transplantation. Kenny is right. Everything is blinded, and if you're on the list, you are getting transplanted based on your need. Now let me tell you where wealthy people do get an advantage. Wealthy people do get an advantage when we start talking about live donation. Why? Because wealthier people tend to have more living people that step forward to try to give them an organ. And that's where, we're trying to actually, take Dr. Calendar's model. Dr. Calendar's model has really addressed the disparity that used to happen in the African American community, because it used to be very, very difficult for Black people to get transplanted because there were not enough matches for people that needed an organ. But given that MOTEP and the concepts that MOTEP brought to transplantation, for African Americans that need to receive a deceased donor from a dead person, we are getting transplanted at a very, very good rate, pretty much at the rate of our concentration on the transplant list. Where we're missing out is on the live donor side. So, what we need more of would be for people in our own community to step up to be live donors. That's where we continue to have a problem based on income. But it's not what you might think, whereas rich people are getting poor people's organs after death. That's not happening. But what is happening is richer people find out about their kidney disease early, and they have lots of family and friends that step up and donate to them. And we can do that in our community as well. And we are doing that, but we need to do more of it. I would love to hear Dr. Calendar's point because, like I said, he's the one that transformed what these organizations have done
Yeah.
in the field of after death
Absolutely.
donation.
I'd like to make a comment also that the beauty of this conversation is that we've first talked about the relatively easiest part of the matter, and that is to go into the community to educate and empower. But we haven't yet talked about what Kenny and Jacolia do with those people who come in when their loved ones have died. Tell us about how you are able to interact with families of people who just died. This is a group of people who may not be as educated. Tell us, Jacolia and Kenny, how do you interact with families of people who just died?
I think it is probably the hardest part of the job, but also the most gratifying part of the services that WRTC provides. Because before we can even get to a donation discussion, we need to help a family understand some very complex medical terminology and medical diagnosis. People who become organ donors in most situations have died from neurologic death. It means their brain has died, but the rest of their body is still being maintained mechanically. And so we need to help families to understand that decision in a very caring and compassionate way. And we also need to meet them where they're at in terms of their grief. And I don't think anyone leaves home expecting not to see the people who they care most about that evening. So we tend to meet people at the worst possible time. WRTC has a trained staff of family services professionals. Many have social work backgrounds. Some are pastoral and their background, and others are in grief, have grief training. But what it allows us to do is to serve the community by providing professionals who are equipped to meet families at that very difficult time, to help them process the information that is being given to them by the medical community, confirm their understanding that their loved one has died or suffered a non survivable injury, and then empower them to memorialize their loved one either through making a donation decision or in cases where someone has already designated themselves a donor on their driver's license or another instrument to be part of honoring their wish for donation.
And I would just add to that that a big part of our mission at WRTC is to provide care to our donor families. It's actually the heart of our mission. And so after these families have, gone through the worst night of their life when their loved one has unexpectedly died, they make the decision to honor their wish to be an organ donor or to authorize donation on their behalf. We provide bereavement support to these families. We follow these families for at least 18 months. We let them know the outcomes of their loved one's donation. We can say, your loved one's kidney went to a man in his 40s. Obviously, with privacy, we're not able to violate any of that, but we let them know the outcome so that they can be proud of their loved one's gift because their loved one left a legacy, and that's what it's all about. So we give them opportunities throughout the year to really honor their loved one and to pay tribute to them in this meaningful way. And we know that for a lot of our families, that their decision to donate their loved one's organs makes a big difference in their grief process because it brings so much comfort and healing knowing that their loved one exists in other people and has given other people a second chance of life.
Awesome.
Yeah, I just wanted to say, I know this personally. My mother-in-law actually had was an organ donor, and I just thoroughly uh, appreciated as clergy what WRTC did with regard to how you make families feel during this particular time. In particular, the sort of service, if you will, that you offer. That was it was a worship remembrance sort of service that it was just tremendous, and it really touched my wife's heart and our entire family's hearts because we could sense that the organs and the donation was a gift of life to preserve a life, and that's something that I just wanted folk to hear as one that has experienced it personally. Dr. Calendar?
Yeah, how about boy? That's a wonderful testimony. How about those families that say no? How do you interact with those people?
So I think the one thing I'm most proud about is the WRTC has a consistency in our service to the community and the compassion that we show to grieving families. So any family that we come in contact with, they're offered the same aftercare, whether they choose to donate or not. So the things that Jacolia spoke about our grief support and our seminars that we do during the holidays and our bereavement care, any family that we interact with, those services are offered to them also. The same time we take to help them understand what is being conveyed to them by the hospital in terms of their loved one's condition, even after they make that decision to donate, and it's not in favor of donation, our team remains to support them until that family is okay. We're very consistent in that service to our community.
Dr. Melanson?
Yeah, I wanted to say because again, going back to the caller's question, I again in the subtext there was a mention of how people that meet their death at an untimely fashion, how their organs are taken from them and given to certain groups of people. And I will tell you that one of the myths is that you go to the hospital and the doctors will not do what they need to do to keep you alive and so you can be an organ donor. But the reality is actually exactly the opposite of that. In other words, what we are doing in hospitals across the country, we are actually going above and beyond when people are injured and they have grievous injuries that may lead to their death. Well, these hospitals are keeping these people alive And one of the reasons is that to have a discussion with the families, like Kenny said, most of the people that are going to wind up being organ donors, their bodies remain alive for a period of time, but their brain does not get good blood supply. And so the brain dies, even though the body's alive for a period of time. Well, in that scenario, you can have a discussion with the family, which is why I said earlier, it's important that you discuss with your family what your wishes are, because the family will ultimately make that decision. So you can discuss with the family that the fact that this person wanted to be an organ donor, and the family can make that decision. And I tell you, throughout my entire career as a transplant surgeon, I've been just so dumbfounded and awe-stricken by the fact that these families, like Mr. Boyd said, at their lowest point. I mean, there is no lower point than losing any loved one, but particularly a young loved one. I have 4 young sons, right? And I can't imagine, I can't even fathom what it would be like to lose one of my children. But I've seen families over and over and over in that time of absolute unconsolable grief make a decision to save someone else's child, right? And that's what makes organ donation so beautiful, and why all of us that's involved, from transplant surgeons to these organ procurement organizations, we love what we do, even though it's so difficult. But it's the circle of life. And it's beautiful that people in this country, time and again, have made that decision to save others. And again, I keep beating the same drum, but what Dr. Callender has done for minorities in particular, to let them understand what I just said, right? And we get it, because we love our people just like anybody else, and we're saving their lives. And that's beautiful that we do this in this country, particularly at this time when we're so divided in so many other ways. We are all united in trying to save our loved ones.
Well, preach, sir. You always try to sneak a
I'm
preach
coming
in.
at you. I'm coming at you, Reverend Curry.
Mm.
I may be in your church Sunday.
Well, that's fine. You won't preach, but you'll be there. No, you're always welcome. I'm wondering if we have any of the other comments that are from our audience. I will just share one. It happens to be from my wife, who happens to be listening. Uh, she said, yes, as my husband mentioned, WRTC provided outstanding grief support and bereavement care when my mom passed. I didn't know what to expect, but I certainly didn't expect any support beyond the act of the transplant. It was beautiful and very helpful. Uh, wow.
Uh, I would like to make a comment that one of the things that we haven't yet talked about is the fact that the opportunity to donate organs is a fabulous thing, but so is the opportunity to donate tissues. Uh,
Ah,
the corneas so the blind can see,
mm.
uh, joints and other things so the lame can walk,
Oh, I hear
bones
you,
in
sir.
the ear so the deaf can hear. So that you talked about the organs saving about 8 lives, but tissues can save many, many more lives. Can you tell us a little bit about your efforts along the tissue donation realm?
So, with tissue donation, we know that where only 1% of people will die in a manner that they can be organ donors, 99% of people will die in a way where they can be tissue donors. Tissue
Hmm.
is a life enhancing gift, it improves the quality of life for patients. But I would argue that it's a life saving gift too, because if someone cannot see, or if someone is in a situation where they need this gift of tissue to change, their outcome, I would argue that that is life saving. But oftentimes we see skin donations are used for burn victims. So if you were in a fire or a tragic car accident and you survived, but you needed skin to heal those wounds, that's a big use. A lot of Athletes who have had ACL surgery don't realize that their gifts came from a tissue donor. Sometimes dental procedures that you have also come from a tissue donor. So
Mhm.
it is an amazing gift, and we celebrate our tissue donors every single day. They can heal more than 75 lives. So one donor, 75 people. It truly is remarkable.
And Jacoly, that was so well put. And just to put a nice big period on that, one of the other patient populations that benefits most from tissue donation is in the pediatric environment,
Mm.
because we're able to recover heart valves from small donors, and those heart valves are then implanted into pediatric recipients. And when you have a valve defect within your heart, you really have two options. You have the option of a man-made valve to replace it, and then you have a human valve. If you have a man-made valve, there's medications that you'll need to take, and all medications, while they benefit you, have the potential for side effects and consequences. And the other thing is that that's man-made; it doesn't grow. So if someone at 9 months gets a heart valve implanted, the heart's going to grow, but the plastic is not. And when you do a human valve implant, then that actually lessens the need for repeat surgeries and improves in the quality of life for that child. And so when Jacolia talks about tissue donation being life saving, it truly is life saving for those recipients.
Wow. Go
Can you
ahead,
tell
Dr.
me
Callender.
what is a love walk? I heard that term. Can you tell us what a love walk is? Because I think somebody told me that was one of the most emotional things that they'd ever seen in their life.
Go ahead,
So the
Jacolia.
Yeah, so the term that I've heard used, I'm sure it's the same thing as an honor walk.
Yes.
And we have really seen this request come from our hospital partners. So these are the ICU staff, the nurses, the doctors, all healthcare professionals that care for this patient as they're fighting to save their life. And at the times where they do have irreversible injuries, they want to honor this patient. And so what we have seen is our hospital partners come to us and say, how can how can we honor this organ donor? How can we support their family? What can we do in this moment to really pay tribute to this person and their life-saving gifts? And so what we see is hospital staff come down and line the hallways of the hospital and pay respect to the families. Dr. Melanson, one of the most emotional honor walks I attended was actually at your hospital, and it was with a Coast Guard commander who had passed away unexpectedly from a motorcycle accident. And her family was there. They gave us permission to share her story, and they played taps in tribute to her as her family walked her to the elevators to go to the operating room to have her life saving organ donor surgery for others. And so it's just they're really emotional moments, and we're hearing a need from our hospitals that want to honor the patients and their loved ones in this way. So they're very meaningful when they do happen.
Mm.
For our staff also, I think it's validating for our team.
Well, that's a great point. One I thought about. It seems that there's some mutual beneficial sorts of things that go on when you do this honor walks or the love walks, and I just can't imagine how it just helps your staff to know that they're contributing to life and freshness of life through organ donation. There's another question that has come up in the chat. It's by Miss Williams, who says, how would you respond to a would-be organ donor who is reluctant to sign up because they fear that the medical professional caring for them in an emergency would be more anxious to harvest their organs than to revive them? I think
Uh,
we started down that way, but I'd like to hear your response to her question.
Absolutely. So, first of all, thank you for your question. I'm well positioned to answer this question. Before I got into this industry of organ donation, I did work at a trauma center, and I took care or was part of a team that took care of critically ill patients. And I can assure you that we don't have access to your driver's license at that point, and the focus of the providers are stabilizing and treating your injuries. Organ procurement organizations are separate entities. We are separate from the hospital. And although hospitals are required to call us based on government regulations, that call only comes after a patient has received all interventions and it's clear to the care team that that patient is most likely to die.
Mm. We hope that really helps you, Ms. Williams. Um, Dr. Belanson, further follow up from you in terms of questions you might have?
Well, yeah, I loved what Jacolia said in her response of about the honor walks, because I do believe that when you work in this area, I mean, you can't help but
Yeah,
be inspired by the patients, right? That's what really keeps us all going. In the transplant world, I get to see the other side when people get transplanted, and I remember I've been a part of a lot of the celebrations with organ procurement organizations, and particularly WRTC. And I remember one of the most emotional things I've ever seen was where during one of these celebrations, where a family that lost a young loved one, where this mother had lost her son. And like I said, I already talked about, how emotional that would have to be for a mother to lose her son, particularly a young son. And her son's heart went to a middle-aged gentleman.
wow.
And at the celebration, she had on a stethoscope, and she got to listen to the heartbeat of her son in that man's chest. And of course, she was overcome with grief, but she got to see there in the embodiment of that man who was dying without her son's heart. She got to see the circle of life. And we see this all the time. And like I said, it's sensational and mythological for people to get caught up in these false controversies. But
Sure.
the reality of organ transplantation and of donation, it's a beautiful, beautiful story. And it's religious in its nature. I mean,
It is.
this is really the circle of life. I mean, you have children. I used to do all the pediatric transplants at Children's National here in DC. And, so many of those children that are now adults, I transplanted them when they were children. They got organs from deceased people and now are adults going on with their lives. And one of those kids who's now, a young man, volunteers with WRTC all the time. So it's a beautiful story when you know the reality of how this gift transforms the life of patients. And that's what the focus needs to be. And that's what it is. And that's why we always never tire in telling the story.
Wow,
Let me
that's amazing. Go ahead, Dr. Callender. Jump
let me
in.
tell you about the closing the loop on that, because just last week, I guess it was, I went to the Transplant Olympics, and
Oh,
what
wow.
the beauty about it is that those same people you've transplanted who received organs and tissues now getting gold medals and bronze medals and silver medals. And the donor families and the recipients are meeting together. And so it kind of closes the loop, pointing out the beauty of transplantation, and to see those people who actually were invalids before, who now are competing with swimming, basketball, ping pong, other things. That whole circle of life that you spoke of is demonstrated in the Transplant Olympics that they have every 2 years. They had it in San Diego this year.
Dr. Callen, can I just add something to that also? Jacoly and I do a lot of work with our community, and one of the things that we do through our ambassador program is to really harness the energy of our donor families and our recipients to tell this story. But this year, what was really special for me is I started in transplantation in 1993.
Mm.
And so as I grew up in this industry, you meet a lot of recipients, but there was a really special little girl who was an infant who received a heart transplant. And this year, that little girl gave us a card to let us know she had made her decision to go to Spelman. And
Wow.
so to see, and I'm sure I'm free to say her name, Jacolia. So Olivia, who is and her parents are great supporters, but when you talk about the importance of our work and how we continue, I think Dr. Melanson and Dr. Callender represented well in speaking of the circle of life. But I think in our community, what we have to understand is, and I'm not going to come to church, Dr. Curry, this weekend, but I will say this: I think in life there are always chances when negative forces try to snatch away joy. And
Absolutely.
when you watch Olivia, who at 3 months wasn't supposed to live, and maybe another little baby who wasn't supposed to die, and so it may look like darkness won. Olivia will go to Spelman and go on to do great things. And how is that where somehow, some way in this world we live, good always wins?
Well, good will always win. You're talking about how truly transplantation is bringing some light into darkness, potential darkness, and overcoming it. And that is no more than something that is religious and spiritual, and really brings closure to the full cycle of life. It says that we keep going,
We
and
keep going.
we continue. I did want to ask a question around things that you would hear in a community. And one of those is, if I'm a person who doesn't eat a certain type, or has a certain diet, or have dietary restrictions. Let's say I don't eat pork. Um, are there situations where the person would have some trouble with receiving an organ from a person who did eat have a certain other dietary restrictions? And I'm just curious about that, because I've heard that in the community. If if you are passing away with all of these sort of things that you've eaten, I would not want that particular organ in my body. What do you say to that?
I've
Well,
got to say, you've stumped me. I'm going to let Dr. Melanson take this one, or was it Dr. Callender? But I have to say, you've stumped me. I've heard a lot. I've had people say, you won't want my organs when I die because I eat way too many potato chips. So I've heard that one. But you've definitely stumped me with this question. I'm going to let one of the medical experts answer it.
yeah, Dr. Curry, people oftentimes say things of that nature. And what happens every time someone dies, when they come up to be an organ donor, we do all these tests to look at the function of their organs, and that's what's important. It's at the end of their lives, are the organs healthy? And although there are some issues with people that have diseases like diabetes, if you've had diabetes for a long time, and of course if you're really obese, these things impact your organs. But for the most part, what someone's diet was it doesn't really impact what type of organs that they have for transplantation. However, I will tell you, and I've seen this in my patients over my career, that after transplantation, people might start having cravings for food that they never craved before, right? So you might have someone that ate a very bland diet throughout their lives, and then all of a sudden they want spicy food, or someone that never liked a certain dessert, and then they crave the dessert, and because people have asked me to do research sometimes when they don't know the donor, if it's a deceased donor, and oftentimes you find that the person that they received their organ liked that food that they now crave, or they liked spicy food, and the patients now crave it. So there's, when you get an organ, you're not just getting that particular organ, but cells from that organ go out into your body.
Absolutely,
And
they do.
they can have far-reaching effects. Now, I've never heard of someone that might be kosher or halal now wanting to eat pork because they got an organ from someone of that that ate something differently, but I've definitely heard cravings, particularly sweets and spicy food. But again, the the goal is to save your life.
Yeah.
And when somebody, it's kind of like you're in a burning building, and you're not going to ask that person that's coming to pull you out that burning building, what's your religion, or did you vote for Trump? No, if that person is coming to pull you out that burning building, you going with that person, right? So that's what's important. This is
I would
about
say that's true.
getting your life saved.
I would say that's true, generally speaking. But that's a question that's come up, as well as a question of organs that are being grown, let's say, in pigs. Folk are having serious bioethical challenges with that. And I wanted to raise it here because it's an interesting issue. I agree with you. If the house is burning, put the organ in me. Do whatever you need to do to remedy and fix the situation. But I am just raising these questions, and
Yeah,
I'm glad
the
we
pig
need to think
question
about
is important and timely, because as xenotransplantation,
it's the hottest thing happening.
exactly. Now, what I've heard from the Jewish leaders and the Islamic Church is that even though these organs are coming from pigs, and they with their diets they don't eat pig. Again, it's about life saving, and we had the same thing with the vaccine, right? Because sometimes porcine cells were utilized not in the vaccines that are most popular in this country, but in some of the vaccines that were used in Europe, they were using porcine cells to incubate the viruses.
That's
So,
right.
these issues have come up, but once for all of the major religions, everyone says pretty much the party line, which is if it's to save your life, that's what's important. The animal that they're utilizing to as a vehicle is not important.
Yeah, I would think that would make sense from my religious standpoint. I can't say for all, because there are some religions that won't even go to the doctor, but that's their chosen belief system. Um, Miss Daniels or Mr. Boyd, have you heard of any strange reasons why folk perhaps either would not give up their organs or perhaps would not receive a certain type of organ in
Uh,
any sort of way?
one of the first opportunities I had to learn about community outreach was watching Dr. Calendar, and
Hmm.
I can still hear his words. And he said, we're concerned that we won't be able to see Grandma when we get to heaven because
There
we
you go.
donated our eyes and won't be able to interact or walk. And so I think people still kind of have that fear, and in our spiritual walk, we know there's some people who are on milk, and other people who are a little more mature in their faith that would
Absolutely.
understand that, you know, if you knew what I knew, you'd be trying to get away from your flesh, and I take it with you.
Uh,
But I'll leave that for a sermon.
oh,
But
now that can come to church Sunday.
that can
But
so I
but
was invited somewhere. Dr.
That can
Melanson
come
wasn't.
to
Thank
church
you.
wait. Kenny's trying to become a preacher now?
That's
Man,
right.
Yeah, well, that was profound.
come on.
If anybody understood any of the major Abrahamic religions, for sure,
Yeah.
Yep.
that becomes significant.
Yep. But that's what we hear more common than anything else is I came here with it. I need it when I return.
Mm.
Yeah, and I think a lot of people rule themselves out when they're considering organ donation. You wouldn't want my organs. I like to drink on Friday nights, and sometimes I'll have more than 3 glasses of wine. Or you wouldn't want my organs because, I have this medical condition. Please do not rule yourself out. At the time of your death, doctors will make a medical determination of who is eligible to be an organ donor, and your gift could impact so many people. Also, when you think of xenotransplantation and some of the changes we've had through the years and technology and science, if you rule yourself out today and then your death is not for another 30, 40 years, think of science and how it will have caught up, and how, someone who might not be eligible today will be eligible, 40 years from now. So please don't rule yourself out. Everyone can register to be an organ donor.
It's a great point, Jacolia. I think one of the things I realized after 30 years in this industry is when I started, we didn't even evaluate organ donors past the age of 50.
Mm.
And we have had organ donors here in the Washington, D.C. area as old as 86 years old that have gone on to save lives. And it's very important to understand that more than our outside, our inside are a reflection of our lifestyle. So there are 80-year-old people who look better than some of our 20-year-olds.
Talk, sir.
And the oldest organ donor on record, it was 95 years old, and his liver saved a 70-year-old woman. This was not in our local area. It was in Pennsylvania, or excuse me, West Virginia, but 95-year-old, and he had a healthy, functioning liver that saved another woman.
Wow.
How do you register?
So you can register. I know this is a national broadcast. So visit registerme.org. It takes 1 to 2 minutes to securely register to be an organ donor. Very simple questions, just identifying information. You can also use your phone number at registerme.org. So we understand some people are not comfortable using the last 4 digits of their social security number or their driver's license, and that can be a barrier sometimes for folks. So feel free to give us your phone number. Again, that's registerme.org. You can also register if you have an iPhone in the Health app. That's that little heart app that you can't delete. Apple does not let you delete that app. I've tried. You can register there to be an organ donor securely. And then again, at the DMV and MVA, you can do it online. Many people are in this pandemic environment, but next time you are doing any sort of vehicle renewal or registration, you can check the box yes at that time.
All right. Well, we're nearing time for to end this great conversation, but I wanted each of you, the panelists, to have opportunity to have any closing thoughts around organ transplantation. So let's start with you, Mr. Board.
Really quickly, I think that donation is probably the one thing that reminds us how much we are the same, even though we spend so much time trying to convince each other that we're different. Because you can take an organ from one person who looks nothing like them culturally, physically, ethnically, and put it in someone else and restore their life.
How about that?
And I would just say that I know a family that almost said no to organ donation. They were very concerned about the myths and misconceptions, and they actually had family members tell them no, don't register or don't agree to this. They said yes, and now they say it has helped them tremendously with their grief, and it's the greatest thing that their son did that they're so proud of.
Wow. Thank you. Dr. Melanson.
Yeah, I was just going to reinforce what I think Mr. Boyd said earlier. There's a difference between chronologic age and physiologic age. And some of the most beautiful organs that I have seen and transplanted have come from people that are pretty old, by our standards, over the age of 70. And I remember as a fellow taking care of a patient who had been transplanted 40 years before I met him. And he got a kidney from his grandmother when he was a child. And his grandmother was 69 years old. And I was seeing him 40 years later. That kidney was 109 years old.
Right.
And his function was perfect.
Wow.
So, a lot of these organs, they don't have any time stamp on them. They can go for a long time.
Dr. Callender.
I'm thrilled and excited that National Minority Donor Awareness Month is here, and this program has been so beneficial to all of us.
Well, thank you so very much for this time that we've spent. And I know that I have truly been blessed by having each of you here. And I just encourage everyone to engage in organ transplantation, become a donor, and choose life so that you may help someone else receive life and keep the cycle of life going. May you be blessed coming in and going out. You are one that is going to be the head and not the tail, above and not beneath. Take care and be well. Thank you so very much. Bye-bye for now.